Inside the local hospital in Boko, a Caesarean section on a woman in desperate need. This hospital is located in one of the poorest parts of Ghana. It goes to show how far healthcare delivery here has come. Dr. Clement Opon, an example of a dedicated health workforce offering his expertise where many his like would hardly go. Here he performs more than 3 surgeries every day.
So Upper East has a high population of teenage pregnancies. Okay, I think somewhere in the other parts of the country, teenage pregnancies is seen like a child who has gone to do something. But here, these are married, wedded young girls who require babies. Okay, in my consulting room, I treat patients who are as young as 17, 18, and are still treating infertility, looking for babies. And once these patients are very young and they are carrying babies, labor and delivery is likely to be difficult.
This region already has one of the worst records of maternal mortality. And for some of the women lucky to deliver alive, complications like obstetric fistula occur. Fistula is a childbirth injury which occurs when labor is obstructed and the woman fails to reach emergency care in time.
The patient will be presenting with continuous leakage of urine through their birth canal, through the vagina. As you sit down now, you'll be leaking urine continuously, 24 hours, 7 days a week. Morning, afternoon, night, your bed is wet, you never will be dry.
And courtesy Justice Baidu, we learned a lot more about this condition yesterday as we premiered the documentary Leaking Wounds. Well, this morning, following that conversation, we know that sometimes doctors will recommend a Caesarean section to avoid fistula, but due to misconceptions, some women simply refuse it. A C-section sounds a bit scary, but dealing with irreversible eternal tearing and weakening of the tissues is scarier. My guest this morning is Dr. Sapon Ntiamoa. He's an obstetrics and gynecologist and medical superintendent of West Municipal Hospital, Amasaman, and we're happy to have him here and give us some lessons on C-section. So good morning to you, Doc.
Good morning.
Thanks for coming.
Thank you for having me.
C-section is now very common, but even for an area like Amasaman, do you have people responding positively to it?
Oh yes, Amasaman, West Municipal Hospital has a fully functional theater where we offer maternity services in the whole of West Municipality. It is a very large area with a high population density, but we are able to capture everything, give them the best maternal services. Those that are beyond us, we refer appropriately to either Ridge Hospital or Kolebu Teaching Hospital.
Okay.
But
so,
I must say that we offer very safe Caesarean delivery.
Okay. Do you find women resisting because from up north where this story was done mainly, that's the case in some instances?
Yes. Unfortunately, West Municipality lies within the Greater Accra region, but it's a very remote, or let me say very deprived area in Accra, where poverty is high, education levels are very low, so people's perception of traditional practices are also very high. So there's the likelihood, the very low likelihood of they accepting orthodox methods. So from time to time, we come across patients or clients who vehemently refuse Caesarean section due to certain misconceptions and beliefs. But we are also trained to offer counseling services. So after taking them through thorough counseling, most of them allow us to carry on.
You can't do it with somebody who refuses it. I mean, the person must agree to the surgery before, right?
Oh yes. For every surgical procedure, you must seek consent. Otherwise, you are practicing illegality. You must seek the patient's consent before you carry on. If she says no, there is nothing you can do. So we have something we call informed consent. Before she agrees, you should have explained all that goes into the procedure, the pros and the cons and everything, so that she will make an informed choice.
Why do you think the subject of Caesarean section is still a very difficult one for some women to accept?
You know, we live in a society where the moment surgery, or let me say the local parlance, operation, the moment operation is mentioned, then everybody goes quiet.
Yeah.
There's that fear of operation. You know, gone are the days when I was a small boy growing up, every operation, they put the patient to sleep. So the mindset was that you go to the death boundary and come back. So people were really, really scared. But these days, with advances in technology, you can have your cesarean section safely done whilst your eyes are wide awake. You even have the opportunity to hold your baby after the baby has been removed. I must state that about 90% of all cesarean sections are done with the woman awake. We just do some blockage so that your perception of pain is blocked. So it is safe.
But sometimes it's hard explaining it to people who haven't done it before.
Yes. It's hard explaining to people who haven't done it before, but sometimes we use people who have done it before to help counsel. A lot of professional women, a lot of even our own nurses have gone through cesarean section, not even once, sometimes twice or thrice. So when we point at such people and use them as examples, it helps us advance the course of the counseling. So it helps a lot.
I guess it will help by me saying that I've done it twice with my two boys.
Wonderful.
So, you know, it's
wonderful.
If you haven't done it before, I think you'll be thinking about a lot of things. So much goes into your system. But as soon as you go through the process, then you realize. I saw somebody who refused it, had to go through the normal labor pains and eventually had to do the C-section. So that was more like double the pain.
That is double. And it's unfortunate. Some people, they will just refuse. And you see, we are trained in such a way that we know when exactly to intervene. So when we tell you that at this point, we need to throw in the towel and deliver the baby by cesarean, people must understand us so as to avoid unnecessary complications such as what we've seen on the screen, fistulas. They are very bad complications that we don't want any woman to go through.
The perception that if you didn't go through vaginal birth, if you didn't push the baby out, then you're not a woman. That's one of the things that, you know, going through this story, that's one of the things that people said that made people not agree to the C-section, even though that could have prevented the fistulas that we've seen being reported. What is it about pushing the baby out?
Really, for us, every delivery is a delivery. Whether a woman has delivered vaginally or through C-section, it is delivery. Bible talks about delivery, but Bible did not state exactly where the baby will come from. Yes, Bible did not state vaginal birth. It said delivery. So what will gladden our hearts is a woman carrying a baby for 9 months, going through all the stresses of pregnancy, and then walking home with a crying baby. Not a woman who goes home sick or with no baby or even to the mortuary. No, that is not the aim. The aim is to bring joy to people. So if we opt for cesarean section, which is also very, very safe, then it is good.
But there's a limit. There's a limit to how often you can go and lie on that table for them to take the baby out.
Yes, there is. You know, for every surgical operation or every surgery, there are some complications that could arise. And cesarean section, if you do once, you know, there's something we call adhesions that can form. Adhesion simply means organs attaching themselves to each other and becoming very difficult to separate during the subsequent surgeries. So you do it once, twice, 3 times, there's the likelihood of increased adhesions and therefore making it possible to injure other organs during the surgery. So our advice is that you don't go through. Perhaps it's a way of limiting childbirth and controlling the population and ensuring that our mothers survive. So usually we advise 3 times, and that should be it. We feel that 3 is an ideal situation. Yes.
I know some people who have also gone through the surgery, and that was a long time ago, where they used other things in sealing the wound, where you have to go back for them to take the thread out of you. Yes. So a picture of surgery now brings back those old memories. But we've moved on, haven't we?
We have. Wonderful. I remember one time I did surgery for somebody. She came back after 1 week and asked, "Doctor, when are you going to remove the stitches?" Her complaint was that she hasn't slept because she hears from people that removal of the stitches is equally very painful.
Yeah.
So you can imagine her relief when I told her that, no, these days we don't remove the stitches. We use stitches that can melt into the body, and after a few days, your wound is healed. It's just, you just see a line. Gone are the days when you see multiple punctured points. No, yeah. Now it's just a line. Cosmetically, everything is taken care of. So you can wear your bikini, go to the beach, and have fun. Yes.
It's amazing how far we've come, yet there are still people who resist the idea of a C-section, even when it can ultimately save your life. If there are any things in your mind about what we're discussing, you want it cleared up with Dr. Ntiamwa, you can give us a call, 0302-211-691. I've got a 026 number that I'll share with you as well. You can also send me a WhatsApp or text message, and then I'll pass it across. Essentially, what we want to do is to demystify, if you like, get your head cleared that, there's nothing horrible about a C-section. But it's also expensive, Dr. Ntiamwa.
No, it is not expensive.
Oh.
National health insurance covers cesarean section.
Totally?
Totally.
Oh,
so it is not, of course, unless you opt for private practice. You opt for some of these private clinics, they may have their own charges. But if you visit any of the Ghana Health Service facilities where they do cesarean section, it is absolutely free, covered by the National Health Insurance.
That's fantastic.
Yes.
The other thing I've been told is when you do a surgery, what is most important is how you take care of yourself after. So what are the rules?
Well, gone are the days, we gynecologists are basically pelvic surgeons. What I mean is that we don't interfere so much with the intestines. So usually after operation, within 6 hours, if everything is fine, the patient can go about and eat her normal food. And we also advise our patients, also because we are pelvic surgeons, there's the danger of, if you lie continuously in bed, danger of what we call DVT occurring. So we encourage people to ambulate, to be walking around. And yes, these are, after just a few days, 48 hours, 72 hours, the person can go about her normal duties without any complaints or problems. Yes. Of course, a bit of pain is to be expected, but we give adequate pain relief to ensure that everybody is comfortable.
I was told you don't have to carry heavy things immediately, buckets of water. Or we've moved on from that episode as well.
We've moved on, but once you are recuperating, we advise that you walk around and minimize strenuous exercises in all forms, yes. But after just a few weeks, you will be fine. I've seen women who are able to carry on with their duties after just 6 weeks.
Yeah?
They are just up and about, and it's fantastic. You need to see such women. We have plenty in our facility, plenty at Ridge Hospital where I used to work.
Let's speak to Tony. Tony Che is calling us from Elembele. Tony, good morning.
Yeah, good morning.
Thank you for calling. Let's hear you.
Thank you too. I like the program that you're having this morning.
Thank you.
Yes, but please, there is this issue I have with my wife. She's a nurse. I'm also a nurse, but we have a cesarean session, and anytime we are to, go to bed, she keep on complaining that she thinks because of the cesarean section, she doesn't want to have an affair with me. Not that she doesn't have to, but it's like she's no more interested in having an affair as she used to have with me. She keep on complaining. Even though we are two professional nurses, I keep on advising that I don't think we should have problem with it, because I knew if there are issues with it, I knew how we should address it. But she doesn't seem to agree with me, and we are having issues with our marriage. Sometimes she even goes to the extent that if I think I can't bear with her situation, maybe I should find myself out.
I get you.
So I want doctor to be clear. I'm calling her to also listen to the program.
Okay,
So
that will be good.
Address our marital issues.
All right, but Tony, how old is the baby?
2 years. Our small girl is 2 years.
2 years. Okay.
2 years.
All right. I appreciate you sharing this with us, Tony. Thanks a lot, Doc.
Yes, thank you, Tony, for the wonderful question. In fact, I must stress that cesarean section and sex, there's no problem having sex after cesarean section or making love after cesarean section. In this case, 2 years after cesarean section.
That's long.
Very, very long.
Yeah.
You see, under normal circumstances, if everything is fine, when a lady delivers, you say that 6 weeks after the delivery, the body goes back to its natural position, the way it was before pregnancy, so she can safely resume sex. But occasionally, because it's a surgery, a lot of inflammations may occur here and there, so it prolongs their recovery. But usually, after maximum 3 months, the lady is safe to have or to make love. I must state that, Tony, you need to seek further clearance for your wife. You need to go and see a doctor. If possible, she should be made to see a counselor.
Maybe there's something more psychological.
Yes, disabuse her mind of some of these perceptions because it is not real.
Okay.
Yes.
All right. Adelaide is in Tamale. Adelaide is joining us. Good morning, Adelaide. Thanks for your call. Hello, Adelaide.
Hello, good morning.
Good morning. Let's hear you, Adelaide.
Please, my term is not CS, but I delivered last week. Yesterday was my 1 week.
Okay.
Hello.
Yeah, hi,
Please,
Adelaide.
I said I delivered normal.
All right. Congratulations to you.
Thank you. Oh, I didn't get the baby. Yesterday was my 1 week, but I didn't get my baby.
Okay.
I lost the baby. I lost the child.
We're sorry to hear that. But what reason did the doctor give you?
So I don't know. My child weighed 4.0, and the people were telling me that I was supposed to request for CS. But I don't know what I was supposed to request or the antenatal place. Whether they are to book me for the CS. And now my child too is gone, and as I'm talking to you now, I have a chest problem.
No, Adelaide, so what did the doctor, how did they explain it to you? Why did the baby die?
In the afternoon, my child they were hearing the child heartbeat.
Oh,
so later,
okay.
they started, around 1, they started telling me that the child heartbeat is going down. And from there, they told me that the child is dead in my womb.
Even before delivery?
He said...
Even before you could deliver?
Yes, I delivered a dead baby.
We're sorry to hear that, Adelaide. But we'll try and see what Doc will have to say on that. Thank you for sharing, though. Yvonne is also in Tamale. Yvonne Bonsu, good morning to you. Hello, Yvonne.
Hello.
Yes, hi, Yvonne. I can hear you. Good morning to you. Thanks for calling. Let's hear you.
Morning. Malavi, good morning.
Good morning to
Hello.
you, Yvonne. Yvonne, I can hear you. How are you? Hello, Yvonne.
Yeah. I had CS 2 months ago.
Okay.
And after the CS, 2 months now, I still feel pain.
You still feel pain?
I still feel pain
okay.
when I urinate. What's the cause? I want to find out the cause.
Okay.
I feel pain anytime I want to pass out urine.
All right. Okay. Thank you, Yvonne. Doctor will address that. Let's speak to Kwesi Apia from Teshi, and then we'll come back to you. Kwesi Apia, good morning.
Yeah, good morning.
Hello, Kwesi.
Yes, good morning.
Good morning. You're not our coach, are you?
No.
Okay, let's hear you.
Yeah, I wanted to bring up something of recent. When your wife is going to deliver, they demand blood. They demand that you donate blood before. And my wife was scared to be given blood. So they refer her. She was delivered at the Kosovo Hospital. She was referred to Kofodia Hospital, General Hospital, if she would not take blood or would not donate blood. Then when she had contraction, she was sent to the Kosovo Hospital. And the doctor that was called didn't want to perform, to deliver. But fortunately, the nurses did. And even the following day, the doctor was angry with her that she even didn't take her, come and even look at her. So I don't know why it is so bad, but she delivered safely without C-section.
Okay. So finally, she went through the vaginal delivery, right?
Yes.
Okay. All right. Thanks. Doctor will have something to say on that, so just keep watching. Let's speak to Inusa Fuseni, who is in Tamale, and then we'll come back, I promise you, and address the things that you've raised. Hello, good morning to you.
Good morning.
Yes, sir. You're on air. Let's hear you.
Okay. Please, I'm Inusa from Tamale.
Okay.
Please, I want to know the number of times a lady is supposed to go for a C-section.
Okay. We've talked about it already, but for your sake, we'll run through it again. Thanks a lot, Inusa. Okay, Doc, there was Adelaide, who delivered, but the baby had died. But I think they kept telling her the baby was losing
the heart rate.
Exactly.
Yes, I should say that I must sympathize with her. It's not an easy thing to carry a pregnancy for 9 months and deliver a dead baby. It is something that is very, very dear to our hearts. So that's Adelaide, right?
Yes, that's Adelaide.
My sympathies to
She
Adelaide.
wasn't given the option of a C-section. Apparently, she should have requested for it.
No, it is not that she should have requested. Probably, miscommunication. The whole thing boils down to communication, effective communication. When we doctors, or for that matter, midwives, identify that the baby is in potential jeopardy, then we take a decision, explain it to the client, and the client gives the consent for us to go on and do the surgery. I don't know what may have happened. Anything could have happened. For us in Ghana Health Service, anytime a death occurs, be it a baby or a mother, we subject it to vigorous audit to look at where the issues were, so that we'll be able to find answers to them and learn lessons so that such issues do not occur. Again, I'm sure the facility where she delivered will have that audit. Findings from the audit will be communicated to her.
So she can always go back and demand for answers?
She can always go back.
Okay.
And
all right.
I can see from the way she was talking that she has pain. Yes. Fortunately, the regional director of Ghana Health Service, Dr. Linda Vanotu, has set up a counseling center at Adabraka Polyclinic, where such women who have lost their babies are encouraged to go. There are professional counselors there who will take them through a series of counseling sessions.
But she's calling from up north, so...
Oh, she's from up north.
Yes.
Probably something like that may exist.
Okay.
She just has to go to the nearest hospital for the necessary assistance.
Okay. Yvonne also called. She's had a C-section 2 months now, and then she experiences some pains when she's urinating.
Yes, Yvonne, pain during urination may be due to a lot of factors. The commonest may be an infection in the urine, in your urinary system. So I suggest you visit your doctor and get the necessary investigations done and treatment. It may not be related to the cesarean section at all. So it may just be a coincidence. It could have come if you hadn't had cesarean section. Okay. So visit your doctor for investigation and treatment.
Okay. Kwesi Apia also called from Teshi, but I remember Inusa's concern, and it was a bit complicated for me, but you were listening. I think there were 2 transfers in the process because they didn't want to accept blood. Exactly. Yes. When you're doing C-section, you wouldn't necessarily need it, but it has to be on standby, correct?
Yes. You know, we all drive or we sit in vehicles, and we are mandated to take insurance, isn't it? Yes. You don't wait until your car crashes before you go demanding insurance when you haven't paid any premium. So demanding that clients donate blood is a kind of insurance against unknown things in the future. Yes, a woman going into labor will not prompt you that I will bleed. No. It can happen. You can do all your things to prevent it, but the woman can still bleed. And when a woman bleeds, it is blood that we use to save her. So it is actually advocated that any woman who attends antenatal is encouraged to donate at least 1 unit just in store, so that in case she needs it, we will just fall on it and give it to her. Just in case you do not use it, it doesn't mean that it's not necessary to donate. If you do not use it, the same blood can be used to save somebody's life. Because there are times where people bleed and you realize that just the 1 unit they've donated is not enough for them. I've seen situations where people have been given 8, 10 pints of blood and they survived. So the question is, who donated those other pints?
Yeah.
Yes.
And I think from my personal experience, you have to sign a form and consent to it even before you go into the surgery.
Yes.
But if you can also opt and say no.
Oh yes, you can say no. You can say no. It's purely based on your consent. It's a surgical procedure. And every surgical procedure, you have the right to say no. And I must also state that you have the right of second opinion. If you think you do not agree with what the doctor is telling you, you can always consult another doctor. But the problem with labor is that we are hard-pressed with time. Labor is a timed event. So assuming that the baby's breath is not too good and we need to intervene, maybe the heartbeat is going down, 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 down. That is not the time for you to
try and get a second
opinion. No. You have to take a decision within a split of a second.
Yeah.
So sometimes we just counsel you, seek your consent, and then we go on.
Okay. I think that was Kwesi Apia's question. You know, sir, I remember now you were asking how many times, and I said we had talked about it.
Oh, yes.
3 times you said was advisable.
Advisable.
That was just a precaution.
But I've seen people going 4 times, 5 times. Yes. But we advise that 3 times is okay.
Okay. There are messages on WhatsApp and SMS as well. This one says, I've had a C-session for the 3rd time, and my last one is exactly a month today, but I still feel some pains around the line. This one says, good morning, Mama V. I had a C-session 9 weeks ago, and my question, doctor, is, can I take herbal medicine from now? Okay, Michael from 2nd D says, why is it that in Ghana after C-section the stomach becomes big as compared to other countries? That's Michael from 2nd D. And the final one, this one says, Nanama from Kumasi says, I'm 24 years and this is my first pregnancy. I'm 40 weeks, 2 days pregnant now, and I've been having the Braxton Hicks for the past 2 weeks. The doctor said induction will be done on me because the head of the baby is down by Saturday, but I'm asking if I can go for CS. That's your question. I think there's the last one that I missed, and then we'll come back and address, because we've got to wrap up this quickly and bring you entertainment. This one says, Doctor, I love your program. I want to find out the cause of big belly after CS, and is it possible to have second child through the normal way after 1.5 years? That's from Jemima from Kwewu. Thank you for all your messages. Maybe we can take Jemima's own.
The last one.
The last one, yes. Which the question appears twice. Why does your belly become big after CS? Is it bigger than the normal?
Oh, not really. You see, again, I must address some misconceptions.
Okay.
People feel that when you deliver by C-section, you cannot do certain abdominal exercises. I've seen a lot of women who have delivered by C-section, yourself included, and you do not have a big tummy. Yes, all because you sought advice appropriately and you knew how to exercise your tummy. There's this misconception going on in our communities that once you are touched by a knife, you cannot even wear corset and do other abdominal exercises. But that is what is contributing to the big tummies in Ghana and Africa. But in Europe and other places, they do that. They have people who have specialized in feminine exercises after birth. So it helps reduce the girth.
Okay.
Abdominal girth, yes.
Okay, the second part of the question that says the child is 1.5 years. When can they get pregnant again and do another cesarean session?
No, in fact, we advise that if you have had one cesarean section, let me address this. It is no more automatic than the next one will be C-section.
You can have the vaginal
birth? Yes, a lot
of
the time. There's what we call VBAC, vaginal birth after cesarean section.
Okay.
A lot of people have gone through cesarean section for one reason or another, and their next delivery, they deliver
But
vaginally.
1.5 years, is that good enough time?
We have certain conditions that you need to satisfy before we allow you to deliver vaginally. 1.5 years interval is the appropriate time that we allow for inter-delivery period when somebody has cesarean section. So she can safely get pregnant, and after 9 months, that will be 2 years plus something. So it's appropriate.
Okay. This person says, can I take herbal medicine? It's been 9 weeks now since the C-section. I wonder why she's asking for herbal medicine.
Unfortunately, I cannot answer questions with regards to herbal medicine. I am trained in an orthodox way. We offer orthodox services, and I have no idea about herbal medicine.
Okay, so let's take the final one, even though the questions are many. This person who said she's 40 weeks, 2 days pregnant, and doctor says they have to do induction. She's asking, can she do C-section?
Well, when you get to 40 weeks, in fact, the recommendation is that a lot of facilities have their own protocols. Where I have been working, our protocol is that you don't go beyond 41 weeks. When you get to 41 weeks, the doctor will have to assess your condition.
Okay.
Assess your condition and determine whether you are a candidate for induction of labor. If induction of labor is indicated, that is the first option. You do not straight away jump to cesarean section, because as much as possible, though I am here demystifying the fears about cesarean section, I'm also an advocate of vaginal delivery. So what we are saying is that as long as vaginal delivery is possible, it is the way to go.
Okay.
Yes.
All right. We've got to wrap up, even though the questions are a whole lot now. We'll see. Maybe Friday we can bring you a second part of this conversation. But we're grateful to you, Dr. Sapon Ntiamoa, and he is the medical person in charge at the Amasaman, the Gun-West Municipal Hospital in Amasaman. Thank you so much, sir,
thank
for
you
being
for
here.
having me.
And we thank you for watching. Stay with us. Becky is up next. Ketsi Etel. She brings us some entertainments. Thank you.